What does informed consent for venlafaxine, otherwise known as Effexor, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about venlafaxine. So venlafaxine is an SNRI, which means that it is a selective norepinephrine and serotonin reuptake inhibitor. So it basically has all of the same effects as an SSRI, plus more because of the norepinephrine effect. It's FDA approved for use in major depressive disorder, generalized anxiety disorder, social anxiety, as well as panic disorder. However, you'll also see it used off-label for a number of other conditions, both psychiatric and somatic. So you might see it used for things like OCD or PTSD or PMDD. In terms of somatic indications, it's sometimes used off-label for migraine prophylaxis, as well as to help with menopausal symptoms, things like hot flashes. It can also be used off-label to help with fibromyalgia or other neuropathic pain. Sometimes it's used off-label to help with ADHD as well because of that norepinephrine effect. It can be quite stimulating for people. And sometimes it's used for urinary incontinence as well as cataplexy, which is basically a symptom of narcolepsy where people lose their muscle tone all of a sudden and they can't help it. Venlafaxine is not often a go-to for me because of a couple reasons. One, I do find that it's pretty stimulating and can worsen people's anxiety, and most people who have depression also have anxiety, but also it's very hard to get off of, and we'll talk about that shortly. Of course, it's going to carry all of the same potential side effects as the SSRI, so it can cause things like stomach upset, nausea, diarrhea, abdominal pain, constipation. So we do recommend taking it with food to minimize the risk of these symptoms. It usually is pretty activating, but of course, some people are going to have a different reaction and it might cause them to feel drowsy, so it's okay if you take it in the morning or at night, whatever's best for you. There can be things like headache, dizziness, weakness, change in appetite, sexual dysfunction. There's going to be a slightly increased risk of bleeding. There can be fatigue, excessive sweating. Of course, we're going to warn people about the risk of serotonin syndrome, especially if they're taking other serotonergic medications. Venlafaxine, like many other psychotropic medications, can prolong the QTC, which puts you at risk of a dangerous arrhythmia. So it's important that if you have a cardiac history, you're having any palpitations, or you're on other medications that can also prolong the QTC, that you get an EKG to make sure that it's normal. Other possible side effects, like a lot of antidepressants, is going to lower the seizure threshold. It can also sometimes cause low sodium and blurred vision, which for some it's just due to the dry eye, but for others, like if you have narrow angle closure glaucoma, you could get something called acute angle closure, and that is a really dangerous condition that can lead to blindness. Venlafaxine, because of that stimulant effect, is also going to increase your blood pressure a little bit, so it's important that your provider is monitoring your blood pressure if you're on this medication. No matter what study you look at, there's been a lot of studies that show that the antidepressants are safe and they're easy to get off of, et cetera, et cetera. However, all of them have shown that venlafaxine is one of the worst offenders of causing withdrawal symptoms. So even after you've only taken it for 8 weeks, there is a greater than 50% chance that you're going to have significant withdrawal symptoms. So the pathognomonic withdrawal symptom is brain zaps, where you kind of have a jolting feeling in your brain, but there can also be things like feeling dizzy, having an upset stomach, having insomnia, worsening anxiety, crying spells, mood lability, and more. And so it's really important that with the venlafaxine that you don't miss doses. Like if you even just miss a day's dose, you're probably going to notice those symptoms, but also that if you decide you want to get off of it, that you take a hyperbolic taper approach. So after going through all this, I would answer any questions the patient might have, and then we would go forward with a shared decision from there. If there's another psychotropic medication that you want to hear me go through the informed consent process for, then put it in the comments below. I'm also putting together an email list for those of you who are interested in my content, because I may have future courses or offerings, and I want to be able to communicate directly with you all about those. So if that's you, then send me a DM with your email, and I hope to see you in the next one.